DocTalk is brought to you by Merck Animal Health, the science of healthier animals.
Hey folks, welcome to DocTalk. I'm Dr. Dan Thomson here at Kansas State University, and today we're going to talk about different types of wounds and management and different things that you can do when they happen to your dog, your cow, your horse, and just how you can treat some of these. It's going to be a good show, I hope. We'll see you after these messages.
As dependable as the sunrise, in dairy parlors, open pastures, on ranches and feed yards across America. A place where reputation is more than a name, where the science of healthier animals is a way of life. It's the responsibility that drives who we are and what we do. Every decision, every day. It's your livelihood and our responsibility.
Closed captioning brought to you by VetGun with Amel and new AMA Abamectin Vet Caps, the 1-2 punch against hornfly resistance from AgriLabs.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hey folks, welcome to DocTalk. I'm Dr. Dan Thomson. Thanks for joining me today. We're here at Kansas State University where I serve as the Jones Professor of Clinical Epidemiology. I am a full professor in the Department of Diagnostic Medicine and Pathobiology and focus a lot on animal welfare, on beef cattle practice, and pretty much anything bovine is what I do in my day-to-day job. And I've really had a fortune of some of y'all coming to K-State to visit. And if you see that we're having a meeting here, you're always welcome to come down to Manhattan, Kansas and see what we do here at K-State. Anyway, today I wanted to take some time and talk about wound management. And there's so many different types of wounds that cattle and horses and animals get, but the main ones are lacerations, puncture wounds, and then we're going to talk about abscesses. And let's start out with lacerations. And the most common laceration is, we use a lot of wire around farms, and we use it for fencing, we use it for fixing things, we use it for everything except for brain surgery. And when we think about wire cuts and barbed wires and lacerations, hind limb of an animal going through a fence, the brisket area of an animal that's getting pushed through the fence by a coyote or some sort of predator or gets spooked. And so understanding that when we get that animal that has the laceration, the first thing is how soon did we find it? And sometimes we find them right when they happen. Sometimes we find them a few days and healing has already started. It is absolutely amazing the way that cattle are built to start building granulating tissue in and start the healing process so fast. So the first thing you do is we get the animal into a place where we can safely treat them. And I can't overemphasize that enough. You need to have some place because you have to have access to that wound, and you have to be able to do that without getting your arm caught, without getting your head butted or kicked. And so get that animal to a place, restrain the leg, restrain the body with a squeeze on a chute, something of that nature. The first thing we do is we want to clean around that wound. So we'll debride it or use water or something, garden hose, some way to clean. And we even need to get a brush sometimes, because a lot of times when this happens, maybe there was a storm and we have mud and it's caked in that wound, and the blood will be caked in around that wound and the hair coat as well. So, we might clean it. The other thing that you want to do is use a pair of clippers and just clip all the way around that so you have a nice area where you can see exactly where that wound occurs. That'll also help you with the cleaning process. We'll then use some betadine scrub or some Nolvasan scrub of some soap to clean that, and we can understand. If it's early in the healing process, then we'll go ahead and we might have to sew that together so that it'll heal. If it's later in the process, we may have to trim some of that tissue around the edge of the wound so that we can then sew it so that there's healing intention from that. But the big thing is to get that animal in, clean it up, understand, clip the hair away from the wound, and then find out how far into the healing process we are. If it's already starting to heal, it may be something just as common as a bandage or just kicking them out and watching it. But as far as that goes, cleaning it, debriding it, making sure that we understand the healing intention, get a vet involved if we need it. Thanks for watching Doc Talk. When we come back, we're going to talk a little bit about puncture wounds.
The topic of vaccinology and stocker operations, I think important to realize how diverse the business models are in these types of operations. And the stocker operations is definitely a place where a one-size-fits-all vaccine protocol isn't appropriate. And it concerns me that a lot of stocker operations don't have a good working relationship with a local practitioner or a consultant. So I think there's tremendous opportunity to find the best vaccine fits for these operations. Now, if you're lucky enough to work with stocker operations, you're going to have a network of colleagues that you call. Some of those colleagues are going to be industry professionals and technical service veterinarians, and they play an important role of my access to information about products. So there's oftentimes I will call a tech service vet and ask for details or an opinion or background on a product. And we're lucky where we produce cattle, we have tremendous access to a lot of very, very good products. But I think a lot of people struggle with matching an appropriate vaccination protocol to the operations business model. So we're dealing with animals that are extremely immune compromised, or we're asking them to make a transition into a very complex business model. And there's really a lot to think about what's the best way to approach vaccine. So I think really the first step is your relationship with your operation. You have to sit down and understand the business model. And you need some leadership and some thought from the operators of these places before that decision's made. And I will tell you that the one we're visiting today, how fast cattle move through this operation is very important to how they make money. The other thing that we mutually agreed on is that when cattle leave this operation, we've done our best immunity-wise. You can't do any better. So they realized that building a reputation for providing healthy cattle to the feedlot that do well, that was going to pay long-term benefits. So we use quality products made by major manufacturers that will stand behind their product. We also look at innovative new products that hit the market. So we try to keep up the best we can, use the best technology that's available, and we buy our product from companies that'll stand behind them.
When it comes to stopping hornflies, cattlemen love their Vet Gun. Today they love it even more because Vet Gun now has a 1-2 punch with 2 VetCap insecticides. New AIM-A abamectin can be used in rotation with AIM-L for effective in-season control. Each delivers a unique mode of action to manage hornfly resistance. So start your in-season rotation program with AIM-L and new AIM-A abamectin VetCaps from AgriLabs.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
ValleyVet.com, ValleyVet.com, Valley Vet Supply.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here. I'm professor of veterinary medicine at Kansas State University's College of Veterinary Medicine, and we have been doing this show for almost a decade, and it's great to be with you. But let's talk about one of the things I failed to mention as we came away from the laceration is that if we're dealing with an equine species, we need to make sure that we give them a tetanus shot, okay, or vaccinating them for tetanus. So it's always important to either keep tetanus vaccine on hand or make sure you get with your veterinarian to get that animal vaccinated for tetanus. When we move forward to a puncture wound, okay, and puncture wounds are slightly different. A laceration is open and it's what we call aerobic, and so it's something we're not worried about some of the anaerobic bacteria, and specifically what I'm talking about is tetanus, Clostridium, whether it's Clostridium chauvii or tetani, and Clostridium chauvii is what causes blackleg, and tetani is what causes tetanus, and so they need a place in the body that there's not very good blood flow, and so that so that there's no oxygen. And that's what they thrive in. And a puncture wound sets up just perfect for that type of environment. And so if we have a cow that steps on a nail, or a horse that steps on a nail, or if you step on a nail, we start to think a little bit differently about those types of injuries. So when we have a puncture wound or a nail that goes into a hoof, the first thing that we're going to do is we're going to remove the nail, okay? So as we remove that puncture, or if it's a stick in a limb, we're going to remove that stick. It's important to get all of that. If we don't get all of it, what happens is that will seal over that foreign body, and you'll find out about 2 or 3 weeks later that you didn't get it all, because it will fester and form an abscess around that foreign body. So we pull that foreign body out, and we're going to do like we did with the laceration. We want to irrigate that or clean that puncture wound. So we'll use some sterile saline or some tap water, and we'll clean that out and we'll scrub it good. You may need to clip it if it's a puncture wound in the leg. If it's in the hoof, we're going to pull that out, and we're going to maybe take a syringe, and you'll put some betadine solution in there and spray into that puncture wound to try to clean and disinfect that area. If we have a horse, one of the things, or a cow, if it's a show steer or something like that, one of the things you can do over the course of time after you've had a puncture wound or a nail is you can actually soak that hoof in Epsom salt water. And so we'll put Epsom salts in some warm water, and what that'll do is, just like it does if you soak a wound on yourself, it'll around your fingernails or your toenails, it'll draw that pus, or it'll draw that infection out away from that area that we had the puncture wound. So puncture wounds, we have to be concerned more about anaerobic bacteria. Make sure we get a tetanus shot for yourself, for your horse, cattle. Not as much concern, but you can vaccinate cattle for tetanus. You want to then make sure that you irrigate, or we're going to remove the item that caused the puncture. We're there going to irrigate that wound, and then if you want to do second intention healing of soaking that in some Epsom salts to draw that out from the puncture wound, will help you with those types of things. When we come back from DocTalk, come back to DocTalk, we're going to talk about abscesses, and then we'll talk about how things heal in general and kind of timelines. Thanks for joining us. Hey folks, welcome to our Cattle First Minute, sponsored by Boehringer Ingelheim Vet Medica, and today we're going to talk about Clostridial vaccines. And one of the things about Clostridial vaccines is many times it's called, in layman's term, blackleg or something of that nature. But when you hear someone say, I'm going to give a 7-way blackleg, that is the vaccination for Clostridials. Now, all of us that are watching this show are also vaccinated for a Clostridial that's very common in our environment, called Clostridial tetani. and that is tetanus. So tetanus is a Clostridial vaccine that humans and cattle alike receive. Make sure that we vaccinate our calves that are going to be housed on pastures that are high with the blackleg disease with a 7-way Clostridial bactrin. We also want to make sure that we utilize that bactrin when they're going into a grow yard and again at the weaning process. When we want to use Clostridial tetani or tetanus vaccines is if you're going to use the technique of banding to castrate bull calves. Always use the tetanus toxoid. Clostridial vaccines have been around forever. They're one of the most effective vaccines that we have in the world, and they work really well.
You spent countless hours building a strong operation. But when it comes to trichomoniasis, the odds are stacked against you. It takes just one infected bull to take down the whole herd. Damage could include open cows, lost pregnancies, and lost profits. The good news is with TrickGuard, a herd doesn't have to feel like a house of cards.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here. Glad you joined us. Glad you have spent time with us on the show, and today talking about wounds. So we've had lacerations, we've had punctures, and now when we don't see a puncture wound, or maybe there was a piece of wire that hit an animal in the neck and then the calf pulled away from it, and we got some sort of bacteria in that, and cattle are just amazing at being able to wall off when they get an infection. If they get punctured on their skin or on their hooves, the immune system will recognize that the bacteria was drug in on the dirty nail or on the stick. And whether it's Arcanobacter or Actinomyces, these types of bacteria are the ones that actually set up and cause a lot of the abscesses. And so the abscess is the way that the body fights off. So it says, okay, here's a foreign body, here's a bacteria that's got inside my skin. Now I'm going to form a barrier of immunity around that, and I am going to then form a really thick coating inside this area to make sure that that bacteria doesn't spread throughout the body. And so that walling off effect underneath the skin, it's kind of like a pimple, we wind up having an abscess. And so this abscess is set up and it starts to grow from the inside out, and the abscesses get bigger because we've done the walling off so it doesn't grow into the body. So now all of a sudden we see this big lump on the side of the neck or the shoulder of a steer or up on the top butt, and you want to know, well, I better get it in and do something about it. So we bring those animals into the chute. And when you bring those animals into the chute, the first thing you want to do is get a 14 gauge needle, inch to inch and a half needle. Might be shorter if you don't have an inch and a half, just use a needle. My main purpose is go to the apex of that abscess and place that 14 gauge needle in it, because you need to understand what's inside this lumpy, bumpy thing on your cow. And if it's red, that's blood. We don't want to open that. If it's straw-colored, clear serum, we don't want to open that. The only time we want to open these up is if you put that in there and white pus comes out of that abscess. And it's important because if you get it when it's blood or get it when it's serum, we haven't finished the walling off process within that abscess. So you want to wait until that abscess is turned to pus, then you'll know that we've walled it off and it's safe to open that up. So we're going to stick the needle in the middle of that abscess, and when we see pus, the next thing you want to do is you want to palpate that abscess and find the bottom. So we find the bottom of that abscess, and you want to take a scalpel then, and you want to open up the bottom. You'll go ahead and stick it up into the middle of that abscess, and we cut from the low point to the left, low point to the right, and you get that opened up, and you'll know when you do it, because the pus will come out of there like who knows what. And getting all of that out, opening that up, is vitally important. We're going to take a break. When we come back, we'll talk about finishing up how to treat those abscesses after we've lanced them and drained them, what we can do to help the healing process. You're watching Doc Talk. Thanks for joining us.
Some call it a come from behind victory, an unlikely win, a reversal of fortune, snatching victory from the jaws of defeat. This is our moment, our victory dance, because we choose confidence. We choose Zuprevo for BRD treatment. Ask your veterinarian to prescribe Zuprevo. Zuprevo is a fast-acting, long-lasting BRD treatment that you can count on to get the job done. Choose confidence. Choose Zuprevo from Merck Animal Health.
It's easy to spot the man who uses Synanthic. With lower volume and less waste, Synanthic steps up your deworming routine. Get more deworming with less dewormer at Synanthic.com.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hey folks, welcome back to Doc Talk. So we have drained that abscess. After we've drained that abscess, and I'll put on a rubber glove if it's a big one, and I'll actually put my hand up in there and remove some of the clots and different things of that nature. The next thing you want to do is get some 7% iodine, and you want to dilute that in water, okay? And so betadine or diluted iodine solution, and we'll actually then take a 60 cc syringe, and I'll put it up inside the abscess and spray that out, so that you'll help with the healing process within this abscess. So it's really important. So what are the stages of wound healing? And there are 4. Hemostasis, or the stoppage of blood, is number 1. So we've got to stop blood, and so we have clotting factors, and you'll see that the animal gets cut, they bleed for a while, they stop. The next one is inflammatory. So this is what we said, okay, we got a wound and some sort of bacteria got in there. Within 20-30 minutes, an inflammatory response has already started to not only go directly to where that wound is, but also to help calm the animal with an inflammatory cascade to help decrease the amount of pain. We're then going to go to the proliferative stage, and this is over the next 2 or 3 days after the wound has occurred. And the proliferative stage of a wound is you're going to start to see building of tissue. You know, after you've been cut or after an animal's been cut, so the animal starts to have fibroblasts or a scab or something that's starting to heal over that wound, or sometimes with proud flesh and things of that nature, it'll start healing from the inside out, okay? So stop bleeding. We're going to have an inflammatory response to say, hey, we're going to keep the bad guys out and make sure I don't get sick from this cut. Then we're going to start to have a proliferative phase for 2 or 3 days. After the proliferative phase starts the maturation phase. And once we have the maturation phase, that means that wound is sealed off, and now the body is starting to rebuild the matrices so that the animal can rebuild the tissue and come back as strong or stronger than before the laceration, whether it's in the skin, or whether it's a bone, or whether it's some sort of other tissue within the body. These are kind of the 4 phases. The maturation phase is really dependent on the wound, where it's located, and the conditions in which the animal's being housed. So if it's someplace over a joint and that animal's bending it a lot, it'll heal slower than if it's in a place where there's not a lot of stress or tension on the wound itself. The other thing I get a lot of questions about is ointments, healing ointments and things to put on there. The main thing is we want to keep that wound clean. If you need to put dressings over the top of it during the first 3 days until we get to through that proliferative phase, that's important. But Dr. Reinertson said you could put owl poop on a wound and it'd heal just as fast as a lot of these different healing creams that are out there on the market. Thanks for watching today. Appreciate you watching Doc Talk. If it's a bad cut, get some emergency care, get your animal to a veterinarian, work with your local veterinarian. If you want to know more about what we do here at Doc Talk, you can find us on the web at www.doctalktv.com. I appreciate y'all watching so much. Thanks for watching. I'm Dr. Dan Thomson. You've been watching Doc Talk, and I'll see you down the road.
Closed captioning brought to you by Vet Gun with Amel and new AMA Abamectin Vet Caps, the 1-2 punch against hornfly resistance. From AgriLabs.
For more information about this program or previous programs, go to DocTalkTV.com.
Doc Talk was brought to you by Merck Animal Health, the science of healthier animals.